throughout the universal newborn hearing screening that is pretty much mandated by federal law, the goal is to screen the child within 1 month of them being born, and then confirming the presence or potential presence of a hearing loss within the first 3 months of their lives, and coming up with a treatment plan within the first 6 months. By moving quickly for our newborns, we're able to get them the treatment they need sooner, which is really helpful for positive development. So screening can happen within the first week of them being alive, the first few days of them being alive. Hearing tests vary based on what the child is capable of doing. So if they're 2 or 3, they might have to do something like visual reinforcement audiometry, which is pretty much when you hear the bird chirping, look in that direction, you'll see the animation. And that's kind of a way to get a general sense of how they're hearing, but of course that's through speaker, so we're not going to get ear-specific information. As they get older, maybe 3 or so, they can maybe do conditioned play audiometry, which is, when you hear the birdie whistle or the owl hooting, put the block in the box. And that, again, is not going to give you ear-specific information unless they're really able to do that with headphones, which is rare. And then as they get older, age 4 and up, that's when we can attempt more traditional audiometry, which is putting insert earphones or super oral headphones over their ears and having them, raise their hand or tap the button when they hear the beep. So when it comes to children, there's temporary hearing loss that can be associated with ear infections or otitis media. Children's eustachian tubes aren't as vertically oriented as adults, so they're more prone to get a common cold or the flu and then have that spread into their middle ear space compared to adults. So that's more temporary. However, there's a myriad of reasons how children can get hearing loss just from birth. So all the major manufacturers do have some semblance of a pediatric line. The really popular ones that most children's hospitals use around here would be Phonak or Oticon. And it really depends on the individual and, of course, the provider.